etiology in pediatric cataract. As we know, the pediatric cataracts are preventable causes of blindness in childhood, and the prevalence is not very less. It is up to 3 to 4, up to 9 per 10,000 live births. So the causes are numerous, and most common cause is genetic. So the numerous causes listed may be due to presence of mutation in protein coding genes those are responsible for the lens structure, especially in crystalline protein which is present. So there could be unknown cause, there could be genetic, metabolic, prematurity, or intrauterine infections. So the isolated hereditary cataracts in childhood, that amounts to be approximately 25% of the cases, and usually without associated systemic conditions. These are most commonly autosomal dominant and have better prognosis. The classification of hereditary cataract, what are the etiology? These can be zonular, approximately 50% of visually significant congenital cataract. It may be nuclear, lamellar, zonular, capsular, or sutural. So coming on to the polar cataract, the anterior polar cataract usually associated with the persistent pupillary membrane or anterior lenticonus or Peters anomaly or aniridia. Posterior polar cataract may be associated with Mittendorf cataracts, Mittendorf dots, posterior lenticonus, or PHPV. The other types of cataract may be coronary, blue dot, total, or membranous cataracts. These are the various types of cataracts. Systemic association in form of metabolic disorders are one of the most important causes of cataract: galactosemia, galactokinase deficiency, oculocerebral syndrome, or hypoparathyroid. So we need to investigate any pediatric case accordingly. The prenatal infection in form of congenital rubella, toxoplasma, CMV, herpes simplex, varicella again contribute to the many cases of congenital cataracts. So chromosomal abnormalities, Down syndrome, Patau syndrome, Edwards syndrome, also associated with congenital cataracts. Systemic syndrome, syndromic conditions such as Werner syndrome, atopic dermatitis, myotonic dystrophy. There's a list approximately 200 ocular syndromes which may be associated with congenital cataracts. The local ocular disease like children with rheumatoid arthritis, JRA, juvenile rheumatoid arthritis, having uveitis, posterior lenticonus, retrolateral fibroblastia, children on ROP treatment, congenital aniridia. These patients may also be associated with congenital cataract. So drugs, children with nephrotic syndrome on long-term steroid, radiation therapy, trauma contributes to many most important causes of congenital cataract. So we should, whenever we are dealing with congenital cataract, we need to do systemic examination. We need to do genetic, if available, genetic studies, and thorough evaluation is must before we plan a case for congenital cataract for the surgery. Thank you.